you for that.
You're
Wow.
welcome.
Dr. Arata, could that have anything to do with the like bladder control or anything like that down there? No?
Probably not.
Not, eh? No.
No.
Okay.
No, it's basically unilateral symptoms involving the left leg that
Okay.
So it's lower.
out of proportion to what we would see on the right side.
Okay.
It's not uncommon that patients with MS, because of the calf muscle atrophy and loss of tone, get swelling in the legs. Okay, so the calf muscles are like the heart for the veins. The heart is for the artery. So back up. The artery is the muscle that pumps blood out of the heart. Okay, and it does it using valves actually. The calf muscles are the pump that pumps the blood out of the veins, and in the same process uses valves so that the flow goes in one direction. When you have valves in your heart, so the blood's always going out of the heart, right? The muscle squeezes the blood, and it can only go in one direction because the valves don't let it go the other way.
Right.
Same thing happens in your legs. There are valves inside the veins, so when the veins get squished by the muscle, it's pushed back towards the heart. You often see with patients who have MS is that the muscle tone or even the function of those calf muscle is severely impaired. And so as a consequence, the blood is not being squeezed, pumped back to the heart by those muscles that aren't working right. And so you'll see patients who have really swollen or very dark blue feet going up to the calf area. And that's why. Okay, but that's symmetric. It's always the same on both sides or very close to it. On a May-Turner syndrome patient, it's going to be quite dramatic usually. The left side is very abnormal and the right's normal. Okay?
Wow.
No one really appreciates these venous things. They're kind of ignored.
Until they have a problem.
Yeah.
Wow.
Okay?
Thank you for that. Yeah.
Yeah.
You're welcome.
See if I can get my doctor on that.
Okay. Anything else come to mind since?
No.
No? Okay. All right.
Just guess no water. She won't be able to try to move in the pool for
Yeah. for
24
a couple
hours.
Days,
Couple,
let's,
2 days. Okay.
Make sure that's sealed for 40 hours before
Okay.
you get in there. Okay.
48 hours. Oh.
It should be sealed
Well,
up.
if not, go to the pool at home.
All right.
Lying down all day, so. But the nighttime, usually I'm fidgeting and I wake, I keep my eyes open and looking around because I just can't rest, but I rested through most of the night. I
Great.
didn't move, like I said, I didn't fall asleep a lot, but at least I felt comfortable resting and I felt like I could, if I was really tired, I could have fallen right asleep.
Okay. Okay. Anything else that you noticed? I mean,
Warmth.
Yeah, well, I said the warm hands and the warm feet. My head clearer, my vision is a lot clearer. Like,
so you noticed a change there too?
well, I used to go like this and think, oh, my glasses are dirty. but now my vision just like, oh, it wasn't the glasses after all.
All right. And how about your hand? Do you notice any difference there?
I felt a little bit stronger in my left hand, like that was the weaker one. I was, opening up the toothpaste tube with my left hand, which I couldn't even grip, like to pick up something with my left hand. I couldn't do it because my hand just wouldn't cooperate, but I can now hold on to something.
Okay.
And she is generally left-handed for writing and everything.
Yeah.
Too, so.
I haven't tried to write anything, but hold a pen.
Yeah, but just so you can pick up something now. That's
Exactly,
huge.
yeah. I couldn't do that before. I couldn't get my fingers to straighten out enough to even grab it. It would just kind of fall out of my hand because I just
Right.
didn't have the strength to lift it. So.
Terrific. Yeah, okay, good. Any soreness anywhere?
No.
No?
No.
So you don't feel anything here? Or?
I did last night. I remember
Okay.
kind of waking up and feeling just a little bit of tightness, but nothing right now.
Good.
The back of my neck is always stiff, but that's probably because I'm always looking up at people sitting in the chair.
Sure.
But otherwise, no pain at all.
Okay.
No. Even the pain, like I usually get a pain in my lower back, but even that seems to be gone.
Good, good. Okay.
All good.
So that's terrific that you've had some changes this quick. As we discussed, it's something that not everybody gets
Right.
a response immediately,
Mhm.
and because you've gotten a response immediately doesn't mean you'll continue to see gradual improvement. We generally will see over several months actually some continued changes.
Excellent.
So we'll just have to see what happens. I'm glad you're not having any soreness.
No.
basically now just go ahead and start being more normal in your
Just
activities.
start-
You can go swimming tomorrow if you want.
No, that go down to the pool, see if I can get my legs moving. That's the one
Yeah.
thing that still doesn't work. Like I still can just move the toes on my right foot, but my left one still won't move. But-
Did you notice that it was easier transferring from the bed to the chair though?
Well, I don't transfer, my brother lifts me.
Okay, so it was.
But just even sitting up, you know, because I'm lying down and to get myself sat up, but that could have been more just the strength of my hands because I was able to pull myself up.
Yeah, I mean, a lot of people will say that, you know, it's a lot easier to move her, you know, for example, because you're able to help more,
Yeah.
whether it's your arms or legs or
Well,
whatever. I mean,
before I couldn't wheel a wheelchair, but, you know, I wheeled myself, you know, out of the bathroom, like Larry lifted me into a wheelchair, and then I wheeled myself in and out, and then he was just, had to lift me onto the bed so I could change my clothes, so.
I did notice some more strength in her, like in her back, or she's not so limp when
Yeah,
when I'm
just
picking her up.
easier to move.
Yeah, and she did seem to sit up a lot easier in bed last night.
Yeah,
So
this morning when he brought me some stuff from lunch for breakfast, and I actually sat up, like usually I have to put a pillow behind my back to help me straighten up, but I was sitting up on my own eating.
Terrific, that's great.
So, yeah, it's all looking good.
Okay, well, like I said, I mean, hopefully this will continue.
I hope so.
And, you know, we'll just, every day, hopefully it goes by, you'll continue to see some improvements,
Okay, and I'll send you emails, update.
Thank you.
And what about follow-up? Will I have to come back, or do you?
No, so basically, you'll go back into your normal follow-up routine with your existing healthcare. I mean, there's nothing specific with the vascular part, with
Right.
vein puncture.
Just the major?
Yeah, so definitely want to look into that. If you get restenosis, we think imaging to look for it is a complete waste of time and money.
Oh.
Okay, so we don't set you up for Dopplers at 6 months or whatever.
Oh, okay.
If you choose to do that, fine. We have no problems with it.
Mm-hmm.
It's just outrageously expensive for something that I don't think adds anything.
Yeah.
You will have recurrent symptoms if you restenose. I mean,
You'll know it.
It's-
You'll know it.
it's like automatic that
Do you know how long that would take?
Nope.
If there's a.
we
so
really don't.
With everyone, it's different, I guess.
The problem is that the data that we have, admittedly limited, is with techniques that we think are just not really applicable at the moment. I
Right.
mean,
Like you said, they're concentrating more in the veins rather than the valves.
yeah, and if they treated the valve, most likely it's stretched, they didn't disrupt it. And anything that stretches that's got elasticity is going to recoil.
Right.
So if you just stretch the veins, probably, which in most cases, that's what happened with the smaller balloons, they're going to come back.
They just
quickly.
collapse again.
Yeah. So our theory is that if you disrupt them so that they're no longer together, they really cannot recoil. It's beyond recoil.
Right.
Just like you take a
So
rubber
you
band
think-
and
you
you
think-
snap it, it's
So
not
you
going
think
to
you
recoil.
gave them a really good stretch? And
Yeah, and so if that's the case, then you really shouldn't encounter restenosis because we're not dealing with a narrow vessel,
Right.
okay?
Right.
We're dealing with a valve.
So the valve would have to close before they.
Yeah, so I mean, we don't have a way of knowing for sure that the valve has been disrupted.
Mhm.
We just know that from our aggressive techniques, it's most likely that it did. And so far, we haven't had the issues with restenosis that a lot of other centers do because, you know, our goal is to disrupt that valve.
Right.
Time will tell.
Mm-hmm.
You know, Zamboni was 47% restenosis using a 10
Yeah.
millimeter balloon.
Yeah. But he was only doing veins.
Yeah, but I mean, we'll be somewhere between, say, a low of 10%, you know,
Wow.
to 50%, somewhere in there.
Mm-hmm.
I don't think anybody's going to get under 10% for restenosis in any treatment for any vessels. I mean, I think, you know, it's going to be something in that range or a little higher,
Good.
but we won't know. The closest thing we're going to have to, you know, any data point is when the Kuwaiti experience is published and we see what their restenosis rate is.
Right.
But, you know, fortunately, knock on wood, so to speak, we've been lucky.
Dr. Arata, did you use the two balloon method or?
No. So your valves were disrupted without, you know, doing anything extra, which is standard ballooning technique, or large balloon, but
Right.
still standard balloon.
And what was the millimeter on that one?
Let's see, it was 14.
14. Okay. So is that the largest one, single balloon? No.
No.
Okay. Okay. What do I don't know.
No, we get into the 20s occasionally.
Okay.
But you know, the smallest I'll use in a jugular is 12. So you know, it's a decent size. 14 is pretty typical. Actually, for the left jugular, it's probably a little on the large side because the left side is usually a smaller vessel than the right.
Right. But because that one was so badly collapsed, it was give it a little
It
extra.
just needed the oomph of the 14.
Yeah. Excellent.
So it just as soon as you put the balloon through, the flow was immediate, was it?
Yeah. So you know, you pop that valve and then you just see the flow just pouring out.
Wow.
Yeah,
Which is what it's
I
supposed
heard
to
the
do.
comment, oh, I heard, you know, when I was kind of half sedated there, it's kind of like, oh, I heard you guys, both of you kind of go, oh, that looks good.
It's always, you know, you often do these and there's like zero flow, or it just sits there, you know, maybe going forward, just creeping. So you kind of get used to that, and then when you see a normal flow, you're kind of, whoa.
This on tape too. If I did put this on YouTube or something like that, would you have a problem with that? None.
No, delete that comment about that 2-letter thing.
Okay. Yeah. There's everything will be.
You can edit that out. Everything else is fine.
All right, sir. Okay. Yeah. Okay, because I'm not sure what I'm doing, but I'm gonna do something. So try to get some.
No problem.
Thank you.
Doesn't happen in Canada.
Sure.
Because they're really dragging their feet on this, and it makes no sense.
Makes no sense at all. So, all right. So
Okay.
we'll get the other valve fixed. And do you figure there will be any improvement in her left side until that valve is done, or?
It's hard to know. I mean, you know, I didn't really appreciate any swelling. You said you had that heaviness.
When I first started having trouble walking, yeah.
Yeah.
It was like I had lead weights on my ankles.
Yeah, and that's the usual symptom you'll get. It's just a really heavy, tired leg.
Yeah.
So you know, I mean, you're gonna have to go find a physician that can do that up there. And if you
You
need
mentioned
help,
something about a report that you would give
yeah,
me.
yes. So your report's already sent into the center. We did the procedure. They'll then send it to our office, and we'll email it to you.
Terrific.
We'll have a little PDF of the images, so you can actually send them to your doctor.
Excellent.
How about?
We will actually mail them to your doctor if you want.
No, I
Most
prefer-
doctors aren't too receptive to this.
Don't want it to go to them. As a matter of fact, you mentioned you may have a contact for us in Vancouver.
Yeah. So
Okay.
at
Yeah,
University of
include
British
that.
Columbia.
Perfect.
Okay.
Yeah.
Great. So
You can include that with the email, that would
Yep.
be great.
Yeah.
that's awesome. Okay.
All right.
I am so happy.
Yeah.
Good.
Hey, Carol Ann, go ahead.
Today is October the 6th, I believe. I have had my treatment. My hands and my feet feel so much warmer. My head feels clearer than it has in a very long time. I'm noticing some improved strength in my hands and in my legs. Not my left leg, but definitely in my right leg. Before I could only wiggle my toes on my right leg. Now I can at least, no, see, I can't lift it. I'm too tired. I can lift my right leg, and I'm hoping that as time increases, I will get more and more of my strength and my mobility back.
Okay.